Hi everyone, my name is Jocelyn and I will be facilitating the mindfulness intervention called box breathing. Box breathing, also known as square breathing, is a really simple mindfulness technique that's empirically supported, and it's used to enhance focus and reduce stress. So box breathing involves inhaling, then holding the breath, exhaling, and then holding the breath again. And each are for an equal count of time. That's why it's called box breathing. And typically it's for 4 seconds each. The practice is rooted in several therapeutic and performance contexts like military training, stress reduction programs, and then also in clinical practice as well. So some of the settings that box breathing can be used, it can be used for stress and anxiety management, for people experiencing high levels of anxiety situationally, or like such as a student during exams or patients with generalized anxiety disorder. It's also can be used for crisis intervention, and then performance enhancement. Athletes and military personnel and performers use it to stay calm and focus under pressure. And then it's also can be used as a routine preventative practice. So there's a lot of empirical support with box breathing. Lots of studies have shown that box breathing can significantly reduce stress and anxiety levels and improve focus and cognitive function. There's also empirical evidence that supports a reduction in PTSD symptoms in veterans and improving stress resilience in high stress occupations like military. It's actually commonly used in the Navy SEALs, which I thought was pretty cool, but they call it combat or tactical breathing, and they do it to focus and gain control under high stress situations that they come up with in their job. So box breathing's client population is it's appropriate for both adults, adolescents, and children. Most of the time in clinical settings, it's used for adults dealing with stress, anxiety, PTSD, or performance anxiety. And then with children, it's particularly useful for those with anxiety or ADHD. And the approach can be like more simplified for them. Box breathing is particularly appropriate for people with anxiety disorders, panic attacks, PTSD, high stress situations, and attention and focus enhancements. It can be practiced in a variety of settings, such as during a crisis, in clinical settings or group settings. And then you can also do it by yourself as part of your daily mindfulness routine, or when you need to take a minute and get grounded and calm down. And that's one of my favorite things about box breathing. It's that you can teach your client how to box breathe so they can take it out of the clinical setting and use it day to day when they're experiencing a high level of anxiety or stress. So now I'm going to go into a demonstration. For this particular demonstration, I'll be doing it in an office during a therapy session with an adult client who's experiencing anxiety, and I start to notice signs of him becoming dysregulated. So first I would ask if the client wanted to implement the strategy when I'm noticing that they're getting anxious. I would say something like, I notice that you're experiencing anxiety. I have a mindfulness tool that can help manage stress and lower anxiety. Would you like to try it with me? It's a breathing technique. And then to convince a client, I'd say it's a quick exercise. You can do it anywhere, whether you're at home with me or at work, and it's a great skill to have in your back pocket. So first, I ask my client to find a comfortable position. You can either sit down, lie down, whatever feels best for you, and place one hand on your chest and one on your stomach. Breathe as you would normally a couple times. And now try to observe the rise and fall of your chest and stomach. If you notice your chest is rising, but your stomach is not, that means you're shallow breathing. If your stomach is rising, that means that you're deep breathing, and that's what you want because that's activating your full relaxation in your body and getting the most oxygen to your brain. So try to be aware of your breath to ensure that you're taking deep breaths, allowing your stomach to rise. And if you're laying down or seated on a chair, you'll feel that your back's pressed against the surface when you take a deep breath. So close your eyes if you feel comfortable, or keep them open with a soft gaze. We'll start by inhaling slowly for 4, and we'll do it together. 1, 2, 3, 4. Now hold your breath for another 4 count. 1, 2, 3, 4. Exhale slowly through your mouth for a count of 4. 1, 2, 3, 4. And then finally, hold your breath again for a count of 4. 1, 2, 3, 4. So that's one cycle, and let's repeat the cycle a few more times. And then after my clients completed the cycle a few more times, I'd help them process how the exercise went for them. I'd first ask, how did you feel during the exercise? What did you notice in your body and your mind as you were breathing? And how confident do you feel about trying this technique on your own, maybe at like home or work? And do you think that it'd be helpful to do in real time when you're stressed or anxious? And if they are interested in continue practicing box breathing, I would try to encourage them to practice it regularly. I'd say that it's, a powerful tool that can help them manage stress or manage their stress in the moment, and ask them if they'd be open to setting a reminder to practice once or twice a day, or setting a goal with me to practice, even just like once a week, just depending on where they're at. And yeah, that's box breathing. I really like the technique because it's super simple and it's an easy skill to gain, especially when you're experiencing anxiety in the moment. And I like that it's a tool that I can teach my clients so they can leave the clinical setting and do it in real time, like at their home or at work or whenever they're feeling stressed or anxious. So thanks for watching.